Good morning, Mark. The last time we got together, we were discussing how recruitment for ReIMAGINE was going. And, you know, at the time we were very early stages, and then of course COVID happened. So what's the situation today?
Well, just to kind of summarize on that, obviously when COVID hit, recruitment to all studies stopped. So although we were doing really well at the turn of the year, COVID hit not only ReIMAGINE, but every other study going. For the study in which we are recruiting patients who are already on a prostate cancer pathway, we're reliant on patients going to their GP, getting a PSA done and getting referred. And that's obviously decreased a lot since COVID.
And in terms of men that are maybe considering participating, is there anything that you want to say to reassure them about, you know, the controls and so on in place to ensure their safety?
In each of the hospitals that is running the ReIMAGINE study, there are safe protocols and safe pathways that reduce the risk of COVID transmission. The steps that we have taken are, first of all, to try and do as much of the research aspects of the study remotely, so by telephone, email, or post. Secondly, we have taken steps to try and reduce the number of people, both research staff and clinical staff, that will be interacting with the patient having the biopsy. Thirdly, those staff will be wearing personal protective equipment, or what's known as PPE, on a regular basis throughout any clinical areas. That PPE will be as recommended by government and local clinical guidelines. The ReIMAGINE risk study is very important. It will add to our knowledge of prostate cancer and help tens of thousands of men in future. We are asking for some additional blood samples, and during the taking of those additional blood samples, we will take all necessary precautions to reduce the risk of any transmission of any infection, including COVID. The staff will wear PPE, they will make sure they clean all areas appropriately. And so the risk is going to be very minimal to men who participate. You will also be asked to give a urine sample, and obviously this will be done in a private setting, in a clean setting. When you do have your biopsies, and if you consent to us taking those additional 3 samples, like I said, those additional 3 samples are a very small increase compared to the overall number of samples that are taken. They don't add to your risk of infection, they don't add to your risk of bleeding or other side effects, and they don't add to your risk of COVID transmission either. I hope I've reassured you that the pathway we have set up in place is not only safe for you to have your standard care biopsies, and it's really important that if you are worried about prostate cancer, that you seek help, and if you are advised to have a biopsy, to undergo that in a timely fashion. But also, if you are kind enough to participate in the ReIMAGINE risk study, which is going to help countless men in the future, because it will add to our knowledge of how prostate cancer develops and progresses and affects men over their life. Taking part in that study is going to be very safe from a COVID perspective.
And if a man is considering taking part in the Workstream 1 study, does that mean that they will need to have more visits to the hospital or be there a lot longer?
There is no additional trips to the hospital. And when they attend for the biopsy, this is as part of their standard of care. The additional tissues will be taken at the same time as the biopsy. This only incurs another couple of minutes to the biopsy time frame.
I think we'll leave it there, Mark, and thank you very much for the update today.